Everyone, welcome back to the Australian Rotary Health podcast called The Research Behind Lift the Lid. I'm Jessica Cooper, and today on episode 45, we welcome Dr Nicole Hill from the Telethon Kids Institute. Dr Nicole Hill was awarded an Australian Rotary Health Funding Partner PhD scholarship from 2017 to 2020, co-funded by the Rotary Club of Smithton and the University of Melbourne. Nicole's project was a nationwide study on suicide clusters in Australian youth, specifically looking at risk factors and cluster prevention. Nicole is now a research fellow in youth suicide prevention and works with the youth mental health team at the Telethon Institute. Nicole's research involves preventing the occurrence of self-harm and suicide in young people and working with communities and stakeholders to improve equal access to healthcare services among vulnerable Australians. So thank you very much, Nicole, for joining me on the podcast today. It's good to see you again. How have you been?
Yeah, it's been good. I've moved over here to Western Australia straight after my PhD and haven't been able to cross the border since.
Yeah. So all your family are in Sydney, or?
Yeah, that's right. Yep, the family's in Sydney and I've got them visiting next week actually, which will be nice. It's been nearly 18 months since I've seen them.
Oh, wow. So, yeah. Well, that will be good to see them. I know, yeah, you've moved on to a new position now, but I'm really excited to talk to you about your PhD today, and it was on such an important topic. So I guess maybe to start off, would you like to tell us why you chose to focus specifically on suicide clusters during your PhD?
Yeah, I think the choice to focus on suicide clusters is really comes down to the fact that suicide is the leading cause of death in young people under the age of 25. And so it's a really important issue. And what that means is that if we look at other causes of death in young people, whether it be accidents or chronic illnesses, suicide still accounts for the largest proportion of those deaths. And when it comes to suicide clusters, we see this as, I guess, a phenomenon that is particularly common in young people, particularly those who have been exposed to the suicide of a friend or peer. And so we see this combined with the fact that suicide is such an important issue within this population. Focusing on suicide clusters was an important next step, given that communities are often quite concerned when a cluster does occur, and the way a community responds to a suicide cluster can also have important implications for the prevention or reoccurrence of suicidal behaviour in the community. So that was really the reasons underlying my PhD in that space.
Yeah. Well, yeah, as I said, yeah, it's a very important topic, and your project was looking at risk factors and suicide cluster prevention. So I guess could you tell us about some of the research questions that you came up for your project and the methods that you used to try and answer them?
Yeah, so my PhD was funded by a community that was actually concerned about the possibility of a suicide cluster emerging there. And when I was looking for ways that we might be able to help them and guide their response, we found quite a lot of inconsistencies and uncertainties around suicide clusters, how they operate, and how we can detect them, and quite importantly, how to prevent them. So some of the key questions that emerged from this was the role of exposure to suicide. So previously, a lot of studies have proposed that young people who are exposed to suicide are at risk themselves. And this was previously known as suicide contagion, although we've moved away from that terminology now, especially with COVID and the connotations around contagion towards a more social transmission model of suicidal behaviour. So we really wanted to investigate whether exposure to suicide was a significant risk factor. And the second part of my research sought to identify whether we could detect that in the emergence of suicide clusters across a nationwide study. So this involved looking at over 3,500 suicide deaths that occurred in young people over a 10-year period. And this was using data recorded by the National Coronial Information System. So whenever there is a suicide, that information gets recorded into this system, and that involves police reports, coroner's reports, and toxicology findings, amongst other demographic information for each of those individual suicides. So we were using that information to first identify where those suicide clusters were occurring in Australia, what role exposure to suicide played in the emergence of those clusters, and also what are the risk factors and characteristics of young people who died by suicide and were involved in those clusters.
Yeah, it sounds like you had quite a big data set to work with, and there were a lot of different questions that you could answer with that. So I guess with the questions that were part of your PhD, what sort of findings came out of that?
So I guess the first question, which was really examining whether exposure to suicide was associated with an increased risk of subsequent suicide and self-harm in others. So we used a technique called a meta-analysis, and this was drawing on the findings from other studies within the field. And we had over 1 million individual, I guess, data points to examine this research question. And what we found was exposure to suicide was associated with a 3-fold increased risk of subsequent suicide and suicide attempt in others. We also found in this study that exposure to suicide attempt also increased the risk of suicide attempt in others. And this finding was really important because we were able to say with a degree of, I guess, confidence that this is an important risk factor and that young people who are exposed to suicide ought to receive support and interventions during that period of risk. In terms of this second part of the study, so this was looking at the occurrence of suicide clusters specifically in Australia, using information on young people who had died by suicide. In this study, we looked at 3 different techniques for determining suicide clusters, and what we wanted to know was what rates of exposure could be detected within each of those. What we found was quite interesting, and that was that not all clusters, I guess, are created equal, and that different techniques will reveal different locations of suicide clusters, but also the rates of exposure do differ between each cluster. So what that means is that not every single suicide cluster will involve young people who know each other or are linked to one another, and being able to distinguish the types of risk factors underlying each cluster could have quite important implications for preventing them. The third piece of research was then looking at the risk factors associated with those suicide clusters where there were high rates of exposure or linkages between young people who died by suicide. So what this involved was looking at the characteristics of young people who had lost a friend to suicide and died themselves by suicide. And this was perhaps one of the most interesting studies, because what we found was that 50% of young people who died by suicide and had lost a friend or peer lived within 10 kilometres of one another. So we had evidence of quite close geographic proximity. The second finding was that young people who died by suicide and had lost a friend or peer died within the first 90 days. 50% of them had died within the first 90 days. So we kind of view this period as quite a critical window of opportunity for preventing subsequent deaths in young people who have been exposed. And we also found that exposure to particularly violent forms of suicide, such as railway suicide, was quite a significant risk factor in terms of the choice of method in those who were exposed. So we saw an 80% concordance between young people who had been exposed to a railway suicide of a friend and chose that method themselves. And of those who did subsequently die, they weren't necessarily young people who had prior mental health risk factors. And this is quite important when we're thinking about identifying young people who may be at risk. Although having a history of adverse mental health is a risk factor, there were quite a lot of young people who did not have a history of anxiety and depression but remained at risk. And I think that's really important when we're thinking about prevention and who we should target and taking a much broader approach.
Yeah, absolutely. Yeah, suicide is just, it's so complex, and it must be really, difficult as a researcher trying to find those little, ways to sort of prevent it. But it sounds like you found some really interesting findings, especially with that 90-day window.
Yeah, absolutely. It's been very valuable to communities. A lot of them who have come to me during a suspected cluster want to know how long should they be intervening, and what is that critical window, and being able to give them some evidence to support that's been very helpful for them with their planning.
Yeah, and I guess, from the findings that did come out of your research, do you believe that they might have any positive implications in terms of preventing suicides in young people, or perhaps changing the way we approach suicide prevention?
Yeah, absolutely. I think, the research and the findings that were conducted throughout my PhD have important scientific implications to the way that we conduct research. Particularly the methods that were used have filled some really important gaps in our understanding of suicide clusters. But of course, for communities, it also has really important implications, and that's particularly around taking that window of opportunity during those first 90 days, broadening who we perceive to be at risk. So we're not just looking at individuals that have a history of mental ill health, but actually looking at the types of information that they've been exposed to, such as the method of suicide, and perhaps using that to hone in on individuals that may need additional support. And then, of course, looking at the geographic proximity and how we can address that in communities that have been exposed to a suicide. So it's been, quite a lot of implications there.
Yeah. Oh, well, that's great to hear. It's always good that, we're getting one step closer, I guess, to getting better at preventing suicides. And hopefully one day they reduce a lot and we see that reduction.
Yeah, absolutely.
Yeah. I know that you are continuing to work in the suicide prevention field, but has your PhD led to any further studies within the same area, or is your research now taking a different avenue?
Yeah, so my current role at the Telethon Kids Institute continues to focus on youth suicide prevention, and I'm very much continuing research in the suicide cluster space, and bridging, I guess, the research that I did in my PhD. So during my PhD, it was very much focused on kind of the what and the why suicide clusters are occurring and operating. And in my current role, I'm now moving away to more, I guess, those how questions. So how can we prevent them, and how can we support communities that have been affected by a suicide cluster? So one of the pieces of work that I'm doing now is working with the community here in South Perth to evaluate a post-vention response, which is being driven by police who respond to a suicide, and providing referral to a support service for all individuals who have been exposed to suicide. And I've also received a fellowship here in Western Australia to look at the role of access to healthcare services in communities that have been affected by a suicide cluster. So it's really rewarding to see kind of that early research now bridge its way into a much broader program that's making a difference in communities.
Yeah, it's good to hear that, your work is sort of, directly involved with the community as well. I'm sure our Rotarians especially would love to hear about all of that. And, since they are, you've probably seen them around quite a bit at different events, presenting your work and all of that. And I know that they're very impressed with what you do. I guess maybe could you comment on how this Rotary supported scholarship may have helped you in your research career?
Yeah, well, when I was considering doing a PhD, it was on a different topic altogether. But then, having contact with the Smithton community and hearing about their concerns and their needs, it really shaped kind of an entirely new program of research. So that's kind of the first, I guess, impact, is that being on the ground and speaking to Rotarians who are really leaders in their community and are quite aware of what's going on has really helped me find kind of an area where I can make a difference through my research. And I guess the other really beneficial part of being involved with Australian Rotary Health has been literally connected to individuals who are on the ground and wanting to take up evidence and transform that into practice and change in the community. it's one of the most rewarding things that I can come across as a researcher, is to be able to provide evidence to individuals who are then out there and using that to make a difference. And it's been a really rewarding experience.
Yeah, well, yeah, as I said, what you're doing is very important work, and I'm sure that the Rotarians are going to love hearing this podcast today as well, like to hear about all the research findings that have come out of their hard-earned, fundraising and donations. So, thank you for taking the time to join me today. And I guess, was there anything that you wanted to add that maybe we didn't cover today?
Yeah, look, not really. I think I would just, like to thank Australian Rotary Health in Smithton, and also Moreland Rotary in Victoria, who's all been very supportive throughout this entire journey. And I think that's, it's been one of the driving forces behind the research that I've been doing. And just very grateful.
Yeah. Oh, well, thanks again, Nicole. It's been great to have you on.
Thank you.
That was the 45th episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health, and how they are helping us on our mission to lift the lid on mental illness. If you can, please support important mental health research like Nicole's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.